Landspítali is the main hospital in Iceland. Landspítali still is an average size hospital, even at the Scandinavian scale. Obviously it's an enormous hospital in Icelandic scale. We have about 6,000 employees, 800 beds, most specialties. Basically you could say there are only 2 hospitals in Iceland and Landspítali is 10 times bigger than the second largest. So it tells a lot about the situation we have here. IT as part of healthcare is totally essential in everything that happens today. We have about 100 systems. Having this bunch of systems means that we need to integrate a lot. But this also has some advantages. For instance, that we can also get the best product for individual parts. We have got the CIS system for the ICU part, and that fits quite well into the strategy that we have, and we have integrated to other systems, probably more than other hospitals have done.
My role in the CIS project is to be in contact with the clinicians day to day, listen to the needs and interpret them to Cambio. CIS has now been implemented in 7 departments. That's 2 ICUs, 2 ORs, 2 recovery departments and 1 neonatal ICU. Using CIS in different sites helps the clinicians use the same processes, and there's great overview and being able to having the data seen in multiple contexts.
The best benefits of digitalizing the documentation is that most of the data runs automatically and we can use that time treating the patient and attending the patient. A very important thing is that we're using CIS not only in the ICU, but we're using it in the OR and we're using it in the recovery, and it follows the patient. So when we're, for example, transferring patients, sometimes from one hospital to another, all the documentation stays in the same system.
Life in the ICU is becoming increasingly technical. ICU patient needs very close monitoring, and with CIS we can get vital signs down to 1 second, and we also have the ability to measure the fluid very carefully and efficiently.
The CIS anesthesia follows the patient from the start, from the pre-operative clinic until the patient is on the ward again, and there you have everything on the same record. You can say that in the CIS system, wherever you look into it, you only need 1 click to look into. So that's user-friendly, you can say.
I can hardly remember the life before CIS. It's been 4 years now. So what I think is most important then is the collection of data automatically, because it's difficult to remember exactly how it was in that moment. It's important to have, because it's an intensive care unit of course, so you have to have a good overview minute by minute, or at least hour by hour. So I think that is maybe what is most helpful, to have it all electronic and in front of you all the time. Yeah.
There are more complex things that we were completely unable to get before, and those things would be like the caloric intake of the patients, how we are managing ventilators, what's our glucose, how are we treating glucose and so forth. Those things would be, if we wanted to study any of those things, we would be limited by the amount of manual work that this takes to do, and this can be automated. And obviously, you know, this generates quite a bit of electronic data that allows us to describe the ICU populations well, either if we're doing specific projects, but also when we're just navigating what does an ICU in a Nordic country look like.
In the future, I believe that we will have more integrations between CIS and other systems.
Currently we are in quite good shape, and it is decided that when we move into a new hospital, we will stick with this solution we have today.